All right, Nisha the PA, we are live.
Hey guys, it's Nisha the PA over here at Dr. Emer's office, and today I want to show you my gorgeous patient, just one day post-op. Now before I get into his one day post-op results, I really want you to take a look at his before photos because I want to point out a couple of things that we were able to address. Now, he had a previous liposuction before, but you can see that in this photo, it left him with a lot of irregularities. You can see in his chest area, it wasn't well defined, and you can see a lot of the lumps and bumps kind of throughout his abdomen. I'm going to show you a little bit more of his side profile because you can really appreciate the lack of definition that he has to his chest area, and you can also appreciate a little bit more of the lumps and bumps to his abdomen. Now guys, you know our goal here is to give you that super well-defined look. Now get into his after results. Look at how amazing he looks. This is just one day post-op. It's super important to remember that because although he looks super great now, his results will continue to get better. Let me tell you about what we did. Now starting from the very top, you can look before at the less definition he had to his abdomen, and we were able to give him a lot more well-defined, a lot more definition to his abdomen. His tattoos look even more amazing with his super well-defined chest. We did a lot of fat grafting to the chest, especially under the nipple area to really give him a lot of definition there, and as well to the top. We also did a nipple lift and gland removal. Remember guys, the reason why we do the gland removal is because you can't remove that gland through liposuction. So this is a combination of fat grafting, nipple lift, and gland removal that has given him this really well-defined athletic chest. Now, if you move a little bit further down, once again, there was a lot of irregularities to the abdomen from the previous liposuction. Look at how amazing we were able to achieve with the liposuction, right, to remove excess fat. And then we also did the Renuvion. Now remember, in this particular case, I'm going to give you a little bit of tidbit. Typically, we recommend that you do a tummy tuck as well because there's a lot of excess skin here. However, in this particular case, he opted out of the tummy tuck, which is completely fine. We were still able to achieve a lot of the definition that you see today. Now remember, you can see the definition now. Look at this definition to his abdomen. This will only get better. He's super swollen just one day post-op. He's going to heal really quickly. Why? Because we're doing the appropriate aftercare, right? Now remember, I'm going to go over it a little bit because you can't see all of his results, but you can see something else that we were able to address. Look at his arms. I'm going to go over to the side profile area. His arms, we wanted to make sure that if we're going to do the chest, give him this very athletic looking chest that we wanted to match, and do the upper arms as well. So take a look at his upper arms. Look at how well defined they are. Right now it's covered in art, so it makes it look even better. But look at how well defined his upper arms are to his chest, to his abdomen. Remember, this is used with a combination of treatments. I'm going to go back to his front photo so you can see everything together. This is liposuction, internal heating with Renuvion. Remember that when you do liposuction, you want to do the internal heating. That's going to shrink wrap the skin to the muscle underneath to really give you that nice definition. To the chest area, we did fat grafting, gland removal, nipple lift, and then to the upper arms, we also did some fat grafting there. We also did fat grafting to the buttocks, which you can't see right now, but you will be able to see later on once we get more into his after results. Now, remember that this is just one day post-op. Now, you guys may ask, well, what do you need to heal from something like this? Remember, there's 3 different things that we always talk about. Number 1, you want to make sure that you get your appropriate IVs. He's getting his IVs right now. We have our Restore bag. We also have our NAD bag, which is an energy molecule to expedite the healing process. He's also getting his lymphatic massage right now, right? We're removing a lot of the excess fluid that was accumulated during surgery. Remember, we use specific fluid to help with the liposuction.
Someone's saying they love the lymphatic massage. They're talking about how gentle our therapist is.
He's the best, guys. That's one thing about us. Not only are you going to get excellent service from the very beginning, from your surgeon with Dr. Emer, your aftercare as well. Right now we have Adam doing the lymphatic massage. He's like one of the best ever. And then you're also going to get care within the office because we're going to take care of you from the very beginning all the way to the end. We're also going to make sure you have the correct skincare. So even these little areas right here that we had to cut, right, he has his drains in. We have skincare that we recommend you use starting one day post-op, but we also recommend starting at 2 weeks that you do a combination of your Fraxel and VB, your lasers, to help even out the scars, take some of the pink out of it. And then at 3 weeks post-op is when you start to do your body treatments. We're talking about body tone. shown. That stimulates 60,000 reps. We're also talking about Venus Legacy that will further tighten the area and shrink wrap the area, help to decrease the swelling. Remember, this is only 1 day post-op. His results will get better over the next few months, 6 months, and a year. Now, if you guys have any questions, maybe you want to get something like this, it's still time. You still have time to get your summer body just in time for the summer. You guys can get a consultation with us in office, or you can do a virtual consultation with Dr. Emer or myself. I would love to have you in office. You guys know how to reach out to us, slide into the DMs. Until next time, it's Nisha the PA. Once again, he had liposuction, internal heating with Renuvion, fat grafting to the chest, nipple lift, gland removal, fat grafting to the arms, and fat grafting to the buttocks. Until next time, guys, I'll see you guys then. Bye, guys.